my third pregnancy, when I lost Akel, they asked me at the hospital, I had a specialist come in and say, why didn't anyone give you a cerclage? What's a cerclage?
They asked you that question?
They asked me that question, which I appreciated very much so. And that further aggravated me, though, because nobody said anything about a cerclage. And I was over there like, what the heck is a cerclage? And they're like, well, it's when you sew your cervix up. Because I had lost my baby because my cervix was incompetent. At that time, that's what they could tell me. And, it's just like they had these certain things that they could do, and that was end of story.
I was just flipped around and back and forth, and so I didn't get any information. And I got in the room, and I was in the OR room that fast. So I didn't understand. I didn't know what was going on, and I was scared. So, and they just continue on doing what they were doing.
They go so fast. It's just like, so you don't,
Yeah.
It's just how hospitals are.
For me, it was the communication with my prenatal care. Like I said, my doctor would come in and he would keep me up, and then the maternal fetal doctor would come in and she would keep me up, and then having family who had background and to know. One is a physical therapist, another cousin is a pharmacist, so even from the beginning when I got pregnant and all the problems started, I had went to a doctor and he had put me on a water pill, and she said, you better not take that, you're pregnant. Why would they put what made them prescribe you a water pill? And I was like, I don't even know. So then she said, well, you need to go back and ask these questions. And so I think just, once again, the team that I had supporting me was helping me know who.
But it sounds like you need to have a medical degree to be a medical patient.
Yes, I agree. I definitely agree.
What I would say to that, I would actually flip that, and I would say that, is it the responsibility? Yes, it is the responsibility of the patient to come forward and be forthright with good, hard, strong questions and to know the questions to ask. However, is that realistic?
To be our responsibility? No, because we have so many other
so therefore you have a health profession, you have a healthcare profession that should be able to look at patients on an individual basis, care enough to give them the care that they themselves would want. That's what I've heard from each one of you. So I'm thinking that we need to be able to also share with docs what our expectations of them are and hold them responsible and accountable for that.
Thoughts?
It's hard to watch. That's hard to watch. I'm like watching that and trying to think of examples where I've been a provider who didn't slow it down or back it up far enough to make sure the patient's questions got answered. And it's a nice reminder to really try and do that.
I think there's several layers to this, and frankly, not a lot of the layers have anything to do with color, except that I think color might bias the provider about the level of information that they could provide, which is wrong. It takes 2 minutes. That woman, she would have been happy if someone would have spent 2 minutes with her and listened to her and answered her questions. That's all it would have taken. This is the responsibility of the providers. Patients shouldn't come like preloaded with the right questions. I mean, why would I have the right questions to ask an oncologist? And I'm a doctor. I don't know what the right questions are. They're supposed to tell me, in language that I can understand.
So how do you know when you come in to take care of me what my knowledge level is, or how much of this medical terminology I can understand?
That's a great question. I don't. Unfortunately, it's how you interact with me during an appointment.
So this is a balance of listening and providing accurate information at the level that the patient needs. to understand the problem. But at the end of the story, however you end up, you have to say to this woman, is there anything that I've said that you don't understand? Is there any questions that you have that we haven't addressed? And give them time to say, I didn't understand any of it, and then start over.
You take the time to make sure that person understands everything that's there. It really is, it's a level in communication. Most of my patients tell me, wow, thank you for listening to me. You listen.